people hear the word cancer and it's like a death sentence to them. And that's not true. And when we start to explain how we're going to treat it and we have potential for improving it or getting rid of this, then they start focus on the positives. My name is Dr. Fadi Abu-Shahin. I'm a hematologist and oncologist at Houston Methodist Willowbrook Hospital. My older sister was a physician, and I kind of aspired and looked forward to become a physician. I did my internship in a cancer center, working closely with cancer patients. It gave me this feeling that this is the field where I see myself working, and this would be my career for the future. Our first part of the day is catching up on what happened since we left the previous day. Some of our patients may have gone to the ER or showed up somewhere, or some of their tests may come back, and some of them may have called overnight. I come before the clinic, I review all the tests that came back on these patients and take care of the things that need to be taken care of. Good morning, guys. How are you? Good to see you, Mr. Kos. Mr. Kos, he's a 69-year-old patient who is an interesting case because over the course of the last 3 years, he had 2 separate types of lung cancers, but he had a signal in that type of disease that told us a strong response is predicted to immunotherapy, one of the new advancements in lung cancer. Along with a clinical trial, a supportive medicine that was added to it 3 years ago, he had a really good response. Then during that course, he developed this contralateral side. On the left lung, he developed a different cancer. This was your original scan. So the cancer significantly improved, but then we have this second spot. That one, we do not have the same signal that tells us immunotherapy is going to be as effective as happened on that side. So that's why you had the chemotherapy and radiation for that. Looking at the biopsy, we reviewed it with the team. We are still seeing a few cells of this second type of cancer. Knowing that this is not a common story, everybody had to kind of contribute to their opinion. We have between 7 to 8 what we call tumor boards. Those are multidisciplinary conferences that are attended by medical oncologists, surgical oncologists, pathologists, radiologists, radiation oncologists, in addition to all supporting staff, genetic counselors, and nutritionists.
When you put us all in one setting in this conference and we're all looking at the films together and we're all talking about the staging together, and it gives you a sense of confidence that you're working within a group and you all have the same goals and you can convey that to the patient. It gives them a sense of confidence that they're being well cared for.
The consensus that we had is that maybe we focus locally now. We were going to discuss if he would be a candidate to actually remove that area surgically.
Doing the surgery is pretty well we can just get it out. If we do the chemos and all that again, it's going to take a long time.
Right. This particular one, removing it will give us a better chance.
Or if I just did the therapies, it could come back.
Correct. So that's the difference.
Okay. I know that's going to help me make my decision. I'm okay.
A lot of these newer cancer treatments are designed for maintenance, which changes a lot of these cancers into kind of a controlled chronic illness in a way, which is not too different from, let's say, diabetes. Hey, Ms. Sandra, can I come in?
Yeah, of course.
You look great.
Oh, thank you.
So tell me, how did this first week of treatment?
So much better.
Good.
I kept on the nausea medicine and I felt great.
Excellent.
It's like, did I really have chemo?
I love it. So basically we're able to stick to the plan then. Ms. Schmidt, she's an interesting story the way she presented. There's just no screening for pancreatic cancer. It's in a hidden organ behind the stomach. You really don't have a way to catching it early. So it's very unusual basically to find a very early stage pancreatic cancer. And she had actually CO poisoning. And that led to doing testing, which showed an incidental pancreatic mass. So we're gonna stick to it. We said this a weekly treatment at the beginning, and with time we were able hopefully to start reducing. She's 2 years out from her original diagnosis, and she looks this great. She has at this point a low burden disease. Our target is to gradually start tapering and keeping her on some kind of tolerable maintenance until we see that there's a room to come off and monitor. They always ask, why are you in oncology? They think seeing cancer patients all day, that's a depressing field. Cancer is actually not as they make it sound. If you spend a week, you'll find that most patients actually that come to see us are doing very well. Happy birthday.
Thank you.
I know it fell in the middle of all of this.
It did. It was strange timing.
It's going to be actually a good reminder every year of when you finished all this.
I know.
Some good news, as you probably heard, but we'll explain it today. What we see is a complete response, meaning the area of the tumor, it's just a bed of fibrotic tissue, meaning the medicines killed all of it. Same thing for the lymph node. And now, at this point, we are cancer-free. So this, at this point, we're in remission. So all the talk from now on is basically how to maintain the remission. People who want to get to this field, they have something in their personality that they want to help people, and at the end of the day, get the reward of just seeing the result of that. I had patients who had cancer and then they got pregnant and they bring their kids. Medicine is a good field to contribute a lot to change people's lives in a way.